I'm Professor Dr. Mahipal Sachdev, Managing Director and Chairman Center for Sight Group of Eye Hospitals. I am a trained ophthalmologist and specialize in cataract, refractive surgery, and corneal diseases. When you look at removal of glasses, one thing which is very important is that all of us want to be encumbrance free. And the number of people who need to wear corrective glasses or lenses has gone up over the years. Everyone, if you want to live free, if you want to live unboxed, you would want that you don't need to wear glasses. Getting rid of glasses was started maybe more than a century ago by Sato out of Japan, and then came the radial keratotomy. But these were to actually reshape the cornea. They have gone out of repute because they were not that accurate. But with the advent of excimer laser in the about 1985, the reshaping of the cornea became much more computer controlled, much more sophisticated with better outcomes. Then what started as PRK or photorefractive keratectomy went on to a procedure which is called as LASIK. LASIK is now a household name because it has been around for more than about 35 years. LASIK in itself means laser in situ keratomelusis. That means that you are using a laser to reshape the cornea from within. LASIK consisted of two parts. First was to create a flap in the cornea. So if you have the cornea like this, you make a flap on it with a hinge. And then you use an excimer laser to burn specified amount of corneal tissue basis the power of an individual to reshape the shape of the cornea, and you put back the flap and the flap seals on its hole to the undersurface. So this was LASIK. As technology evolved, LASIK became customized LASIK. Every company is trying to get better results. So typically if I am wearing a coat, you can have a stitched ready-made coat which is say your size. So similarly, if you have a particular power on your spectacles, you just work on that to remove that power. Or you can have a tailor-made coat, and that would also look at whether your shoulder needs a little more padding, this one, or your length exactly that needs to be changed of your arms, etc., etc. So that is called as customized LASIK. So there were equipments that are being used to get the total profile, the aberration profile as it is called, of the eye, and then accordingly try to reshape it so that you get good vision. So several claims have been made about that, about the quality of the vision and the quantum of the vision, and each company is coming out with their own contraption for this customized LASIK. Now from there on, from LASIK actually, where the flap, as I told you, is made, which is about 22 millimeters in size, the procedure has become flapless. Once the procedure has become flapless, you are just making a 2 millimeter incision. You are creating a lenticule. So what exactly we mean by a lenticule is that instead of burning that specified amount of corneal tissue, supposing this is the cornea and I have to burn this much of tissue. So what happens is that the laser which is used for making the flap, which is called as a femtosecond laser, that first moves in this plane, then it moves to the other plane. So you have actually created a slice in the cornea and you make only a 2 millimeter incision and you pull out this slice or this lenticule. So it has the same effect as you have in LASIK, plus excimer laser that you have used to reshape. But here we are not burning corneal tissue, we are using a disruptive laser to actually create a lenticule and take it out. So this is called as a lenticule extraction or keratolenticular extraction, and there are 4 or 5 companies who are doing this. The first to introduce this was Smile. Then nowadays what is most prevalent is the Silk, and then you have others, Atos, Z8, etc. They have their own lenticule based procedure. So these are couple of the procedures that are available just now. So these are couple of procedures that we have. It started with excimer PRK, then there is advanced PRK, surface ablation as you call it, then you had LASIK, you have customized LASIK, and now you have the lenticule based procedure. So these are laser vision correction procedures where a laser is used to reshape the cornea. Mind you, this can be done for treatment of minus power, which is called as myopia. It can be done for the treatment of cylindrical power, which is called as astigmatism, and it can also be done for the correction of plus power, which is called as hyperopia. But for all these, there have to be certain criteria that have to be met to say whether the person's cornea is eligible for getting a laser vision correction or not. Now, in the field of refractive surgery, where we are not taking away any corneal tissue, that means we are not ablating, this is like a simulation of a contact lens. But this is a daily routine or a daily procedure that has to be done. So what the technology has done is that a similar flexible, similar type of a contact lens is implanted within the eye. So this is an implantable Collamer lens or an implantable contact lens, whatever you wish to say, or a phakic lens, wherein the original lens of the patient is not disturbed, but we are supplanting that or adding on it a different lens as per the power of the individual. So this technology has really gained ground over the last several years. The thinness of the cornea or the asymmetry of the cornea does not have that impact on this procedure as it would have on a laser vision correction.
Follow Planet LASIK and post your queries to get answers from the experts.